What's an ingrown hair and are they avoidable? Well, stay tuned to find out. The short answer to what is an ingrown hair is it's a hair that is either growing underneath the skin instead of coming out of its follicle, or it is actually turned itself back around and growing back into the skin. But it gets a little bit more scientific-y than that, and that's because there's actually 5 main types of ingrown hair. The first kind is extrafollicular. This is a hair that comes nicely out of its follicle, no problems, but then immediately curls back over and starts to grow underneath the skin. This can leave redness, possibly some soreness, as well as there may even be a visible hair growing underneath the skin. The second type is a transfollicular, and that is a hair that basically grows sideways or parallel to the skin and stays trapped underneath it. Now this may leave a slight bump, and you may or may not be able to see the hair actually growing underneath the skin. And in a lot of cases, there may not even be any pain involved to this type of an ingrown hair. The third type we have is pseudofolliculitis. This is basically caused by extremely curly hair, either curling while it's underneath the skin still, or growing out and then curling into the skin, and it just continues to grow as so. This is a very popular issue with the black population because of the curliness of the beard hair as well as the thickness of it. Pseudofolliculitis can cause inflammation as well as redness, and it can even appear like a bad acne breakout. The fourth type is probably the most common amongst my viewers and the population, and that would be in the form of razor bumps. Razor bumps happen when you shave the hairs a little bit too short just underneath the skin. Usually this will resolve itself within 2 or 3 days. The fifth and last type is a cystic ingrown hair. Essentially, the follicle where the hair comes out of is either damaged or blocked, which means that the hair has nowhere to go, and neither does any of the sweat that comes with it or the oils that your hair naturally produces, which then eventually hardens into a cyst and will need to be removed normally by a doctor. Now, to know how to take care of ingrown hairs that we already have, we need to know what causes them. And some things we can help, like improperly shaving or waxing and tweezing. Those things we have control over and can learn how to do better. As well as things like blocked hair follicles, whether it's from dead skin cells, oils, dirt. Anything that can block the hair follicle can cause that hair to turn sideways and go back into the skin. Tight clothing can also cause ingrown hairs. Just because you're pushing that hair right back down to the skin, it's not going to want to grow the way that it should, and therefore it may grow back down into itself, or it may just decide to take a 90-degree once it hits that skin and start following it instead of coming out of its follicle properly. Now, a few things that we can't really help when it comes to ingrown hairs is curly and coarse hair. As we said with the pseudofolliculitis, that coarse and really curly hair may just be prone to having ingrown hairs like that. And just like the texture of your hair, you can't really control your hormones all that well, especially when you're hitting puberty. Your skin changes, your hair thickness changes, so that can also cause it. And if you're a female during pregnancy or menopause, your hair can also change along with your skin, which can unfortunately also cause ingrown hairs. Now, how do we know if we're dealing with an actual ingrown hair or a pimple or a breakout? Well, I know that I mentioned a few of the signs and symptoms of it already, but let's go over the full list. Of course, you're going to have some redness and inflammation around the area of the ingrown hair. With this, you also may have some tenderness when you press on the area, because after all, it is inflamed, and you will have a hair growing into the skin or right underneath the skin. Ingrown hairs can also cause bumps as well as acne. You may also be able to actually see the ingrown hair underneath the skin. You may also see the skin itself change color, as it may discolor or get a hyperpigmentation in the area of the ingrown hair. And of course, if the ingrown hair gets bad enough or gets infected, there very well may be an infection that is localized, or even a spreading infection that can get worse, which is why ingrown hairs should be taken care of as soon as possible. Which brings us to the treatment of ingrown hairs. The sooner you can identify and treat an ingrown hair, the better off you are. Lucky for us, many of the treatments for ingrown hairs we can do right at home. The first thing we can do is exfoliate. Now, although this may be a little bit painful, it's helping get the follicle clean as well as get any dead skin off of the surface, so that maybe the hair will actually be perfectly fine and pop right up out of there properly like it's meant to do. We can also apply a warm rag or compress to the area to help with the inflammation and redness. And if you're lucky and you can see where that hair is growing at underneath the skin, you can very easily take a sterile needle or tweezers and go ahead and pull that out of there so that it is growing up properly. Just make sure that whatever you use is sterile and that you clean the area both before as well as after removing the hair. Because the last thing we want is for that area to then get infected. You can also use a topical solution with either salicylic acid, glycol acid, or a benzoyl peroxide to help unclog that follicle and hopefully let that hair pop up out of there. If you have redness and itching, you can apply a hydrocortisone to that to help with that issue, so that at least it brings the pain and the itching down a little bit. Now, these at-home solutions should work for a single or even a multiple ingrown hairs a few times. However, if it is a constant thing, just about every time that you shave or whenever you are growing your hair, you should talk to a doctor or a dermatologist, as they're going to be able to suggest things like medications or even hair removal if the case is bad enough. And of course, the best way to deal with an ingrown hair is prevention. If you never have the ingrown hair, you never need to deal with it, and you never need to have it taken care of. So what are some things that we can do to mitigate the chances of getting ingrown hair? The first thing you want to do is make sure that you have a sharp and clean razor. The easier the razor can cut through that hair, the less likely there's going to be of micro points on that hair that'll want to direct the hair a different direction. Shave with the direction of the hair. Shave that direction and only that direction if you're prone to getting ingrown hairs. Don't pull the skin tight when you are shaving. I've never done this, but I have seen other people, go like this to try to get a closer shave. Avoid irritating the skin as much as possible. Remember, the more irritated your skin gets, the more irritated that hair gets inside of the follicle, which can, of course, cause issues. So if you know that you're prone to getting ingrown hairs like around the neck area here, just make sure that you're only doing one pass, maybe two passes there at the very most. The less irritated that it gets, the less chances of you having issues will be. Another way to not irritate the skin is by shaving not as frequently. If you're shaving every day, put that out to every 2 or every 3 days, because you will be irritating the skin and the hair a lot less. Exfoliate regularly. Now, I just talked about this in a video that you can go and check out in the description below, and I explain why we should be exfoliating our face. But in short, we are getting rid of dead skin cells and oil that may be blocking that hair follicle, which would make the hair not be able to come out of it and force it someplace else. So regularly cleaning out those follicles with a good abrasive or chemical exfoliant is definitely a good idea. Don't push too hard on your razor. Not only is it bad for the skin, but you can also cut the hairs much shorter in the follicle than what you may need to, and therefore the hair has more opportunity to grow a direction that it just shouldn't be growing. You can also moisturize your face or the areas that you shave, either with a moisturizing aftershave, or even some of the shave soaps themselves have a moisturizing ingredient in there that can help soften the skin. If the skin is soft, that hair is going to have an easier time getting through the hair follicle where it should, and if it does happen to deviate, it has a better chance of getting out of the skin and growing normally. And something that a lot of these videos keep coming back to when it comes to shaving or hair care or whatever is to stay hydrated. Drink more water than you think. Remember, our bodies need water for just about everything, and that does not fall short on our hair and our skin. The more hydrated we are, the healthier we are, and the less likely of getting ingrown hairs we will be. And of course, if none of these ideas are working for you, it may just be time that you use an electric shaver. An electric shaver will not get the hair down or underneath the level of the skin. So therefore, that hair, once growing properly, it should continually grow out proper, and therefore reducing the chance of having an ingrown hair. And if that doesn't work for you, maybe it's time that you think about just, well, growing a beard. Now, if you like this video, make sure to hit that big thumbs up button so I know that you like videos like this so that I can make more of them. I want to know down in the comment section if you deal with ingrown hairs and how frequently you do. If you like this video and you want to learn more about shaving, make sure to check out this video up here. Down below, that's going to be one that you may enjoy as well. Until next time, as always, you have a good one.